Breaking news, everyday news on Prince Miller Entertainment TV. Remember, guys, to like, share, comment, and follow. Today is the 2nd of September 2022, and so, guys, we keep on following. Is South Africa when it comes to healthcare, and is my foreigners, my illegal foreigners, legal immigrants, and so we need to talk about it because we have so many of our brothers and sisters who lives and works in South Africa, and besides that, we have so many of our family relatives who are traveling to South Africa to seek medical care because in Zimbabwe atoma one major hospitals dzongoa vanenge vasina na mishonga dzongoa avatorina some of the equipment inenge chidiwa kuti vaite surgeries, and so South Africa's health minister Phaahla says the National Health Department is considering charging neighbouring countries for immigrants who access health services in South Africa. According to Phaahla, the department is consulting with governments from neighbouring countries to see how they can contribute to the medical bills of immigrants in South Africa. Phaahla was speaking during a site visit at Kalafong Hospital in Outreach View on Thursday, where Operation Dudula barred foreign nationals from entering the hospital. Demonstrators stood outside the hospital entrance, one with a loudspeaker, as they informed those approaching that illegal foreigners would not be allowed inside. There have been suggestions and acknowledgements that the issue of additional services from neighbors does add additional pressure, and that we must find ways to do with it, including possibilities of contributions for some of the services by the governments of the neighboring countries, said Phaahla. He said the department was looking at organizing for governments from neighboring countries to sign agreements whereby if there is a need for SA to be refunded for providing health services to immigrants, there could be some compensation. Every government has a responsibility to its citizens, so we need to hold them accountable for their responsibility. If South Africans go to Namibia to seek help, the Namibian government must hold us accountable. If, for instance, we are unable to provide renal dialysis and people are flocking to Namibia to get renal dialysis, they must hold us accountable and say, we've got your people who need dialysis, we can provide it, but what are you going to do to compensate? These are the things we need to put into regulation. Earlier this week, government said Operation Dudula was infringing on basic human rights. They go against the tenets of our hard fought for democracy. In SA, the right to access health services is a basic human right guaranteed by the Constitution. SA is governed by the rule of law, which makes provisions for every person in the country, regardless of their nationality or documentation status, to access health care. It said the victimization of patients and hospital employees who are suspected of being foreign nationals should be condemned by everyone. The Southern African Development Committee agreements, which SA is a party to, allows foreign nationals from member states to receive the same care as all South Africans, she said. Minister in the presidency, Motley Gubele, cautioned that preventing access to health care can have dire consequences for patients and a negative impact on the public health system and the country's citizens. We understand the public health system is overburdened. However, doctors and healthcare workers have an obligation to provide health care to those in need. The Hippocratic Oath guides the actions of doctors, which includes them not to withholding services because of religion, nationality, race, politics, or social standing. Government is hard at work to improve our healthcare system and deal with challenges, he said. And so, guys, that's the latest here. And so I do agree with the South African health minister, and the governments, the neighboring governments needs to contribute to the medical bill, because I still feel that Zimbabwe South Africa almost like 20 million or so just for their citizens which were treated in South Africa, of which that money can be used kuvandudza hospitals anenge mu Zimbabwe. And so this is a lesson which I still feel that Zimbabwe have its duty to take care of its citizens. So we're gonna see how this will play out but I still think that we're gonna see a lot of these kind of discussions next year, like 2023, whereby most people, most Zimbabweans vanenge are illegal in South Africa, and again vanavambomire kuenda kuma-hospitals kuma-clinics vanenge vachingoenda vasina mari vanoenda kuma-public hospitals, vane mari dzavo vanoenda kuma-private, but kuma-private you have to pay. Kuma-public hospitals vaimboti unotanga warapwa first wozobhadhara wozokutumirawo bill, but kazhinji kacho vanoziva kuti vanhu havana stable residential address, saka they won't come and pay. So vakuti zoni first of all you need to pay the deposit, then unokurapa and release usati wapedza kubhadhara the remainder of the money inenge ichidiwa pahospital ipapo. And ndozva kutaura kuma most of major public hospitals, which what my foreign nationals, you need to pay first. And so this is daily news, breaking news, everyday news on Prince Mila Entertainment TV. I would like to hear more from the Zimbabwean government. What are the plans are they having, or what are the other alternatives are now ekuti vakwanise kupedza dambudziko iri, because it's a major problem that has been happening for the last 10 years or so. It's only ngoti pari zvino vanhu va sick and tired of it, because vaoneka kutoti the Zim government haisi kusumudza musoro when it comes to their citizens. That's why nyaya dzakubuda, because zvakabvira kudhara zvichiitika vanhu vachiuya vachibatsira kuno South Africa vodzokera kuZimbabwe. So it's cheaper for someone else to actually come to Joburg Hebrew Hospital kuti abatsirwe mwana wake than kuenda kuparinyatwa, because of the conditions ari kuparinyatwa, because of zvinongo vachida on the list in Parinyatwa Hospital, zvinhu zvakatowanda than zvinenge zvichidiwa kuSouth Africa, because uku vanoprovide zvinhu zvakati wandei at the same time dzongwa inenge iri free. And saka this is our daily news, breaking news, everyday news. I'm still waiting to hear more from the Zimbabwean government, especially from the Minister of Health, who is the Vice President, Constantino Chiwenga. The man should be held accountable. The man should release a statement. The man should talk about this, because the more they remain quiet, the more useless they will look. And because you can be celebrating that you are a Zimbabwean if you can fix the health care of your own citizens. And so this is a daily news, breaking news, everyday news on Prince Mila Entertainment TV. Remember, guys, to like, share, comment, and follow. I'm still waiting to also to hear them speaking pamarallies vachitaura healthcare kuti since 2018 kakata ABCD in healthcare wara. I'm expecting to hear this vachitaura kuti how many hospitals they've built, how many clinics they've built, zvipatara makarongeka whatsoever. I'm waiting to hear these politicians vachitaura pamarallies come elections ari kuya next year, because dai zvakarongeka tasamboona vanhu vakawanda vachibva kuZimbabwe vachiya South Africa kuzobatsira vana vavo. This is very, very concerning. This is a daily news, breaking news, everyday news on Prince Mila Entertainment TV. Thank you for listening and watching. Remember to like, share, comment, and follow. Listen.